Chapter 7 Safety First. We will explore safety at home, safety on the playground and in the swimming pool, first aid, safety at school, safety on the road, first aid box. Accident is unplanned and unexpected event which adversely affects our life and property. They cause pain and suffering. Most of the accidents can be avoided by practicing certain safety measures and rules at home, at school, on the playground, and on the road. Safety at home. To avoid such accidents at home, follow these safety rules. We should always keep our home organized by placing things at their proper place after use. Misplaced objects like toys can cause injury if we accidentally trip over them. Do not leave your toys lying on the floor. In the kitchen, we should not play around with sharp objects like knife, blade, and scissor. We should not touch hot pressure cookers, pans, or kettles in the kitchen. Do not play with knife and scissors. Bedroom floor must be kept dry as the tiles become slippery when wet. We should not touch electric press when it is switched on. We should not touch electric fittings with wet hands. We may get an electric shock. Do not touch the electric switch with wet hands. We should not light matchsticks ourselves. It is necessary, then we should take help of elders. There may be some medicines kept in our homes. We should never take any medicine without consulting our parents or doctors. Safety at school. The school is the temple of education. In school, accidents can happen when students run and push each other. To avoid such accidents, follow some rules. We should not rush up or down the stairs. We may fall and hurt ourselves and others. We should not jump or sit on the desks, otherwise we may get hurt. Safety on playground. In the playground, we should follow the rules of the game. While playing, we should wait for our turn at rides. Safety in the swimming pool. We should always use a swimming tube for swimming if we are not expert swimmers. We should always swim with swimming tube in the presence of an adult. Safety on road. Carelessness on the road can cause accident. To avoid such accidents, follow some rules. We should always walk on the footpath. We should avoid walking or driving in the wrong lane of the road. For our safety, we must always wear helmets while cycling or riding a motorcycle. We should not use mobile phones while walking or driving on the road. It creates distraction and may result in accidents. We should cross the road only at the zebra crossing. Look to right, then to left, and to the right again. Cross the road when traffic stops. We must wait for the bus to halt completely before boarding or getting down from it. First aid. Sometimes accidents take place in spite of being careful. In this situation, we should provide some immediate help to the injured person. This help is called first aid. The immediate help given to victim of accidents, burns and wounds before the arrival of doctor is called first aid. Our house should have a well-stocked first aid kit kept at a place which can be easily accessed by all. While giving first aid, be calm and make the injured or sick person comfortable. Do not panic after an accident. Common emergencies that need first aid are minor cuts and wounds, burns, fainting, bee stings, insects bite, fracture and sprains. For minor cuts and wounds, if someone gets minor cuts or wounds, first wash and clean the wound with water. Then apply an antiseptic lotion over it. To prevent the blood flow, apply constant but gentle pressure on the wound using a soft cotton cloth or gauze. Dress the wound with a bandage. Change it regularly to prevent infection. If the cut is deep or it caused by any rusted object, it is necessary to take a tetanus injection from the doctor. If a person faints, loosen their clothing and ensure proper supply of fresh air to reduce suffocation. Make him lie down with his head at a lower level than the body. This helps the blood to reach his brain faster. Call for medical help immediately and stay with victim by the time it arrives. For burns. If a burn is minor, place the affected area immediately under cold running water for at least 5 to 10 minutes. Put an ice pack on the burnt area, then apply an antiseptic cream on the affected area. Consult a doctor in a case of major burn. Knowledge tree. To stop a nosebleed, we should sit straight, lean forward and pinch our nose for a few minutes. For bee stings and insect bites. Insect bites or bee stings are painful. So first remove the sting bulb carefully using a forceps. Wash the affected area thoroughly with water and apply a paste of baking soda and cold cream on the affected part to give relief. Use ice pack on the affected area to avoid swelling. Did you know for an insect bite, we can apply lemon juice or pieces of lemon on the affected area. In case of fractures and sprains, fracture occurs due to breakage of bones. In case of fracture, immobilize the injured part immediately. Use a split to support and prevent movement of the broken bone. A split should not be tied too tight or too loose. It should apply just enough pressure so that the setup remains in the place. Apply ice pack to lessen the pain. Help the victim relieve medical facility at the soonest. Sprain occurs when the ligaments attached to the bone get torn or damaged. In this case, the affected part should be kept still. Apply ointment or take pain relieving medicine on doctor's advice. First aid box. It is a small box containing some essential things which are needed for the first aid. They are sterilized cotton wool, bandage of different sizes, Dettol, carbolic lotion, tincture of iodine, ammonia water, etc. Some antiseptic ointments, some scissors and band-aid, etc. Word bank. Safety rules. General rules followed to avoid accidents. Zebra crossing, a road crossing marked with lines. Antiseptic, a substance that prevents infection in a wound. First aid, immediate help given to an injured person before calling a doctor. Tetanus, a bacterial disease which results in nervous system disorder.